All right, good morning, everybody. Greetings. Thanks so much for joining us here at the Health Professions Advising Center. This morning, we're excited to have Mr. Gabriel Laredo with UCLA's Pre-Medical Enrichment Program, also called PrEP. And he and his colleague Elizabeth are going to be sharing a little bit about this program today. So with that, Gabriel, I'll go ahead and pass it over to you.
Perfect. Thank you so much. I really appreciate it. Good morning, everybody. Thank you all for being here early on a Monday morning. Hope it sets you up for a good week. But again, my name is Gabriel Laredo. My pronouns are he, him, and I am coming from the David Geffen School of Medicine here at UCLA. I'm currently the manager for the Office of Outreach and Pathway Programs. And I'll let my colleague just introduce herself. She'll just, again, be in the background, but just so that you can know another friendly face.
Hello, I'm Elizabeth. I am with the UCLA Center of Excellence for Underrepresented in Medicine. My colleague Esmeralda was going to be here. She couldn't be here, but she did want me to say hello. So hello from Esmeralda. And I'm here just to answer any questions about how our partnership with PrEP helps bring in more students into the PrEP program and specifically for UCR.
Thank you. And so my plan for today's presentation, I'll try to keep it short and sweet, but I'll go over some information about the David Geffen School of Medicine, let you know about some of the different resources we have specifically for you all as UCR students. And then at any point, if you have any questions, feel free to ask, either put in the chat or speak up. I'm happy to answer those. This is your presentation, and so let's make sure you get your questions answered. But I'll go ahead and start sharing my screen. So with UCLA David Geffen School of Medicine, we want you to know once you're here, you are a family. So hopefully you can see yourself at UCLA. This is a building of our main David Geffen School of Medicine, where most of our actions happen, as well as next door, our community health center. But in terms of the David Geffen School of Medicine, we do focus on the HILLS curriculum, and that is a new curriculum as of 3 years ago that has really changed and evolved to really prepare students for just the ever-changing nature of technology and medicine these days, as well as really preparing you for getting ready for residency. And so making sure that this is a dynamic curriculum that can really prepare you. And aspects of what is included in our curriculum include structural racism and health equity. So again, making sure that we can address some of those health disparities that exist. A discovery year, so you can actually get your hands on and do some research and have some practical experiences, as well as that interprofessional education. So connecting with different disciplines and different mentors that can really help guide you in terms of your medical education. At UCLA, we have this tagline of becoming an outstanding physician and blank. Whether that is a scientist, a public health expert, an activist, an artist, whatever your passions are, we want you to bring those. We can take care of helping you become an outstanding physician. We want you to bring yourself, and this is true in the application and what you hear. And I love this statement because it's true. You'll see here at DGSOM, we have over 30 student organizations, ranging from social community service to social ones to future-oriented student organizations just within the School of Medicine itself. So we have very active and engaged students and students that are leaders. And so I know it's early in the morning, but if you don't mind, if you can share what your and would be. Are you an artist? Are you a family member? Are you public health expert? What would your why be? And you can feel free to put in the chat if you want. But yeah, again, we want you to become an outstanding physician, and so I'll give you all some time for that. I know, again, it's pretty early in the morning. At DGSOM, we have one medical school with 3 different tracks. We do have, oh, I see musician. I love it. It's wonderful. We do have 3 tracks. And so we have our traditional MD track, which is 4-year track. We have our Prime LA, which stands for Leadership and Advocacy track. And this is specifically a 5-year dual degree program where you would focus on developing leaders in medicine who are leaders in policy, care, and research for underserved communities. And again, it's a dual degree, so it'd be an MD and a master's. And then we have our MSTP, which stands for Medical Sciences Training Program track, which is an 8-year dual degree MD PhD program. This is a little bit more about the HEAL curriculum. Just going to fly by it, but basically HEAL stands for Healer, Educator, Advocate, Leader, and Scholar. And again, this is a 3-year-old curriculum, so things are continuing to improve and see how things are going, and constantly making it better for students. But basically, the first year is really focused on your foundations. So the scientific foundations of medicine, foundations of practice. You'd be taking classes for about the first 13 months. And then your second year is when you really get to focus on, first year, you also do early authentic clinical experiences. So you get at least once a week going to have a clinical experience. And then year 2, you're able to do clerkships. And there's 8 core clinical rotations, including emergency medicine, family medicine, internal medicine, neurology, obstetrics and gynecology, pediatrics, psychiatry, and surgery, as well as, so you have those 8 programs, as well as intersessions. So these are times where you come back together prepare you for your next clerkship, and also, reflect on what you learned, and then learning additional aspects that would be helpful during your clerkships. Then year 3, I think, is really what helps make us stand apart, and that is our discovery year. So for the whole year, you would be doing longitudinal clinical experiences during this time. So a little bit more focused clinical experiences, and then you'd either be able to do your discovery year, which is participating in research during this time, or you can also do a dual degree. And so on the left, you'll see you can do a 1-year master's in business administration, public health, public policy, clinical research, as well as legal studies. And so this is, just your opportunity to really get really prepared for the next steps and in terms of residencies, and really just dive deeper. This is that deep dive year. And then year 4 is when you finish out your electives and you prepare for residency. So just a quick outline of our curriculum. Obviously, this is for our 4-year track. For the 5-year and 8-year programs, they're a little bit different, but still follow this same outline. So specifically what I'm here today to talk to you all about is about my office, the Office of Outreach Pathway Programs. We do lots of different events. So if any of you are student leaders and are part of student orgs, we're always happy to go to and present to those student orgs about all of our resources. And we also have our pre-med and pre-health guidance center, which I'll talk about soon. We have our pathway programs, the main reason we're here today, and some of our insight series. So I'll make sure to share all that shortly. For our pre-health guidance center, this is a guidance center that you can come to. It's not just for UCLA students, it's for anybody, but it's mostly virtual. So you're able to set up a 15-minute, we always say they're 15 minutes, but they're usually 30 minutes, appointments with anybody that wants to reach out to us, whether you're a counselor, student, parent, or a friend of somebody. We're always happy to meet with you. And we're able to help you find support and resources for any of your pre-health interests, understand the requirements for medical school, and help you create, a general outline of how to apply to medical school, or answer any of those questions. I was a first-generation college student. I didn't know who to go to and ask questions to, and kind of just thought I had to kind of figure it out on my own. Just want to let you know we're here. So any questions you have, even if you're, embarrassed, like I should know what the MCAT is, or, how to apply for medical school, you don't need to know anything. We're happy to kind of meet you where you're at. Make sure you have all the resources you might need. These are completely free. They happen throughout the week. And so we encourage you to sign up for them and meet with some of our staff. And so you'll see that QR code on the screen in case you're interested in signing up for an appointment. We also do drop-in hours every week. So every Thursday from 1 to 2, we have, you can just drop in, and if you have any questions, hear what other questions people are asking. But that is available for you. Next, we have our pathway programs. And so we offer 3 programs: our Summer Health Professions Education Program, or SHPP. We also have our Pre-Medical Enrichment Program, PrEP. And then we have our last program, the Reapplication Program, or RAP. So I see in the chat, is this for students that are currently not attending, this is for any students. So everything that I'm sharing today is applicable to you all and any of your friends at other universities or community colleges. We're open for everybody, so not just UCLA students. So thank you for that clarification. So I'll go over these, but specifically I'll be focusing on the prep program, which could be really beneficial for you all in attendance. So for UCLA SHPP, this is a first year and for first year and second year college students or community college students. This is an intro to the health professions. So we focus on 3 different tracks. We do have a medical track, a nursing track, and a dental track. And so for this whole program, it is really geared towards changing the face of medicine, but also helping improve healthcare delivery, policy, and research in underserved communities. As you know, by helping future leaders in these fields. Again, this is for first and second year students because we really want you to take this, what you learn in our program, and be able to utilize it in your last couple of years. So your third year, your fourth year, maybe if you take a fifth year, but really be able to utilize what you learn. And so we do academic enrichment, we do problem-based learning. So this is a technique that we utilize in our medical school to, you know, look at a patient case and as a group, figure out how can we help this patient. And so you're guided by current medical, dental, or nursing students. We also have track-specific admission support. So depending on which track you are in, we really break down the application process for each one. You meet with the admissions team from each of the schools, and they, on a weekly basis, break down, you know, what is important to know about applying to their individual schools and just those professional schools in general. We do wellness workshops, we do individual advising, we set you up with a mentor during the program, but also you're meant to stay with them throughout the program, or sorry, beyond the program, so they can always help you out. We focus a lot on community development because we also want you to have a network of peers that you can reach out to and ask questions. This is a 6-week program. This year it is June 17th through July 26th, with the first week being virtual and the rest of the 5 weeks being in person here at UCLA. And with that, the first question we get is, you know, how much does it cost? This program is completely free for any student that is admitted into our program. We also cover room and board. So we would cover your dorm and your meals during this time, as well as provide you with a stipend to attend, because you would need, for these 6 weeks, this would need to be your sole priority. And so sometimes we know people have to work and it could be a financial burden. So we do provide you with a stipend to attend. So again, this program is completely free. The application closes February 5th. So if you are a first or second year student, feel free to, you know, get that application in soon. Actually, quick question to the group. How many, you know, can you share what year you are at UCR? You know, are you first year, second year, third year, fourth year, maybe recently graduated? You know, all these resources are available to all of you. So I see third, fourth, perfect. All right. And I'll go into our next program, which is the UCLA Prep program. And I'll spend a lot of time on this because this is our main reason of being here today. The UCLA Prep program stands for the Pre-Medical Enrichment Program. This is specifically for third year, fourth year, and recent college graduates. So I think I saw a question in the chat about, you know, if you already graduated. Yes, you can still participate. And thank you, Charles, for putting this in the chat. I really appreciate it. But yes, this is for third year, fourth year, and recent college graduates. As long as you're not currently applying to medical school after you graduated, you're still eligible for our program. And this program really is focused only on pre-med students. And so this is really focusing on strengthening your ability and readiness to apply for medical school. It has some similar concepts of the previous program I talked about, but we do have how to apply to medical school. We go over that on a weekly basis with our admissions team. We also do an AMCAS overview, so an overview of the application and the different parts of it. We do interview preparation during this time, so we are able to do mock MMIs with some of our staff and some of our current medical students to help you kind of test out those interviewing skills. We partner with Princeton Review to do MCAT review during this whole time. So for the 6-week program, every day of the program, you are in a MCAT review, except on the weekends. But we provide this to you for completely free. And they provide you with resources. They provide you with practice tests. It's a really great value, especially for it being free, but this is really geared to help you start to know. It's not a comprehensive where after the program you'll be ready for the MCAT. Since it's a 6-week program, it's short. It's really geared to help you identify where your strengths might be with the MCAT, and so you have the next couple of months to study for the MCAT and really then take it. And the MCAT materials we give you are good for up to 2 years, and so even if you might not be applying right away, you can still utilize these resources when you are ready to apply. We also do a short research project with you on health disparities. Again, a huge focus of the David Geffen School of Medicine is really addressing those health disparities and structural racism and health equity. And so we want our students to be able to identify, what exists. And so this is an activity that we do that tests you, not tests, but strengthens your research knowledge. If you haven't had any research before, but also, just your awareness of what is going on in the healthcare field. We focus on community development, and I'll show you some pictures, but again, we want you to have that connection with your peers, have people you can ask questions to. We have academic enrichment, so we focus on test-taking skills, note-taking skills, reading comprehension, so that you are a well-rounded student. We also do that problem-based learning again, so you would specifically be in a small group with a current medical student, and they would help you kind of navigate how to approach this case and problem-based learning. We also focus on mental health and wellness. So every week we have at least a 1-hour session with a dedicated therapist that has an amazing resume, but really breaks down imposter syndrome and a lot of the messages we give ourselves, because we know sometimes that, that inner critic is a really strong presence in our mind. And so sometimes we need to learn how to kind of work past that imposter syndrome and some of the negative messages we give ourselves. And so it's always the favorite part of the program for all of our students, because it really not only prepares you for medical school, but just helps you with all aspects of your life. And so that's something that we pride ourselves in talking about and, really addressing. And then again, we do have individual advising meetings during this time with some of our admissions team, but also set you up with a longitudinal mentor, so a physician within UCLA that can stay connected with you beyond the program. So this year, it is a 6-week program. So 2 weeks of this program will be virtual, and then 4 weeks will be in person here at UCLA. So the entire program is from July 8th through August 16th. So we try to make sure that we work with the UCs and other schedules to make sure that it's not during the start of any classes. With this program, we also provide a stipend for you to attend. So you have an option for the stipend. So basically a larger stipend if you want to commute to UCLA on a regular basis, or with this one, it's not mandatory to stay on campus with us. So you can have that first option, or if it would be better for you to, if you want to live on campus and just walk to our sessions, we can provide you with a dorm and then breakfast and dinner at the dining commons, and then a small stipend for to offset some of the lunch costs, so that again we can make sure that this there's no financial barriers for you attending. So some of the core curriculum, like I mentioned, how to apply to medical school, going over the MCAT review, the health disparities project, community development. Again, we focus on, every week we have social hours so that you can connect with one another. We do a ropes course so that you can, do that team building. We go over AMCAS, so like, what BCPM is, how to calculate it, how to prepare for the different parts of the application. And then we are this year trying to figure out some shadowing opportunities for our students that participate. So every year, the prep program is 30 students usually, and then we save 10 spots, so that ups it to 40 students every year. But we specifically have 10 spots for students from Cal Poly Humboldt, UC Riverside, and Cal State San Bernardino. And so that's why we definitely want to connect with you all, because we have specific spots for all 3 schools. And so this is just a quick overview of what what the schedule looks like. So in the mornings, you'll have an MCAT review, then you'll have a 2-hour break, and then usually we'll do different sessions from 1 to 5. And so you'll see this week, this was one of our weeks from last year. So in the afternoon, they did a challenge course at one point. They did some lectures. They worked on their portfolio. They had an academic enrichment note-taking session. We did a microaggression workshop. We talked about, we had a guest specialty speaker. So every week we have a specialty come in. And so I think last year we had cardiology, we had pathology, family medicine, and I'm forgetting the last one. But we have somebody come in to share their story, talk about how they chose their specialty, and just humanize this whole process so it's not as intimidating. And you kind of see where people had their pitfalls and where people struggled to make it realistic that it's not just a simple process. Well, it can be a simple process, but sometimes it does take some resilience. We also have panels of previous alumni to come talk about how the program helped them. We have other physicians come in and talk about their journey so that you can ask some questions. So a lot of different connections. And then we do have some simulation activities that we do have. So we do, here at UCLA, we have our CASET Center, which is the Center for Advanced Surgical and Interventional Techniques. And so you're able to try out some of the surgical or practice on some of the surgical machines that we have, just to kind of get a feel for it and see what it's like. And so always a fun day with our students. Some of the other practical experiences we do have are we invite our different medical schools from across the country specifically for you all. So usually we get a lot of California-based schools, but we invite nursing, dental, and medical schools to come to our offices so that you can come meet with them, connect with different medical schools to kind of figure out which medical school is right for you and see what opportunities they have. And so just makes it easier so that you can, open up your range of, what medical schools you might be interested in. We also do 2 full-length MCAT practice exams during this time, the mock medical school interviews. And so again, testing those interview skills. We have simulation activities. Last year we did suturing. We also did some other biological life systems techniques. And so some hands-on things that you can do. And I talked about the rest. And so I believe here are some pictures. So this is our group from last year at the ropes course, again, some team development and just making sure that we're able to create a strong cohort so that you have somebody to reach out to beyond the program, aside from our office. And these are some of the simulation activities that they were able to do. So understanding, the different sounds you might hear from airways, as well as practicing some life-saving techniques. So in terms of the application, I apologize, it's not TBD anymore. The application is due on March 1st. And so you still have over a month to get it in. What the application requires is a personal essay, financial aid award letter is optional, and then unofficial transcripts. The application will be reviewed, and then for those that move forward in the process, we'll do virtual interviews specifically with those individuals. Again, just want to reiterate, we specifically have spaces for you all as UC Riverside students. So with our HRSA Center of Excellence grant, we can fund up to 10 students to participate in prep. So that is, UC Riverside, Cal Poly Humboldt, and Cal State San Bernardino. And again, what that will cover is we'll travel the round trip costs to travel from and to and from UCLA. We'll also provide you with room and board. So this includes a meal plan for 2 meals a day, so breakfast and dinner, as well as housing in the UCLA dorms, and then a small stipend to offset some of the lunch costs that you might have over the time. And usually that's around $400. And so again, this is specifically the package that we have for you all as UC Riverside students. And then our final pathway program that we have is UCLA RAP, the Reapplication Program. So this is specifically for any California residents that were unsuccessful in gaining admission to medical school. We're able to have a small cohort of up to 10 students, and we work with them over a year to work on their application, to refine it, and to apply again to medical school. So this is an 11-month program, usually from September to August. And so this is like option Z for you all. You all, will do well in your application processing, but we always want to let people know we do have this option. And this one closes May 20th. So we do have this QR code. So if you want to stay in touch with us, we do put on events every so often. Next month, we'll have a whole a day-long webinar on preparing for medical school. So we'll talk about personal statements. We'll talk about how to finance medical school. We'll do different things. We'll have some mock MMI interviews that you can sign up for. We'll also do some resources that exist for you. And so if you sign up for our mailing list, we'll definitely let you know about the different events that we do have. And so don't forget to sign up. You don't have to fill everything out, just the things with the red asterisks, since it can look like a little bit longer survey, but it literally takes 2 minutes to fill out. So if you don't mind doing that, that would really help us out so we can make sure to keep in touch with you and share those resources. And then just a reminder, we do have those drop-in hours as well as our pre-health guidance center appointments so that you can always reach out to us and ask us whatever questions you have. Again, they're open to you all and any other people, as long as they're interested in pre-med or pre-health. Obviously, we're hosted through the School of Medicine, and so our specialty will be in medical school, but we're happy to, if we don't know something about nursing, we'll sit down with you and Google it and figure it out with you. And so we're for all the wide range of pre-health. So I know I threw a lot of information at you, and so I just want to open up to see if there's any questions that might be coming up.
This is great. Thank you, Gabriel. I think you did talk a little bit about the transportation question, but there was a question specifically about, is transportation provided to UCLA?
Thank you for catching that. Yes, so as a UCR student, you are provided reimbursement for your transportation. So you would need to front the cost, and then we would be able to help reimburse it. If you are, say you do go to UCR, but maybe your permanent residence is somewhere else, then we can see about, if you need a flight, then we can see about purchasing that ahead of time. But usually if you are at UCR and you want to drive down, we can definitely reimburse you for gas. Great question. Are there any other questions? Is there a minimum GPA? Okay, so for minimum GPA for prep, thank you for asking. It is a 2.8 minimum GPA. We are holistic application as well, so we do look at your whole application, but we do have some eligibility requirements with minimum GPA being one of them. And again, it's 2.8. It would be a 2.8 general GPA.
I have a question
Yes,
about letters of recommendation. Are they required for any of these programs? And if so, let's say I'm a first-year student, what are some options or ideas about who my letter writers could be?
Thank you. That's a great question. So for our letters of recommendation for our SHPP, the Summer Health Professions Education Program for first and second year students, it does need I think 2 letters of recommendation. So some people that you can ask, if you have any faculty members, that would be great. So any professors that that you're in touch with. If you're not in touch with any, that's okay. You can still start making those connections. And so, asking your professors, getting to know them, going to their office hours, letting them know a little bit more about you. That's really helpful. If you have any jobs on campus, somebody that can speak to who you are. So any managers, supervisors, that also works out. If you're involved in research by any chance, your primary investigator can be somebody great. These are all really great people that you can reach out to. If you are first year, we do accept some recommendations from high school teachers. So if you are still in touch with them, we encourage that. But I think this is always a good thing to think about, especially when you're getting ready to apply to these professional schools. It's important to have really strong letters of recommendation. And so if you haven't yet already gotten to know your professors, get to know them a little bit better, go to their office hours, and stay in touch with them. Keep them updated on what you're doing, because it's always helpful to have these people in your back pocket later to, say, hey, would you be willing to write this letter of recommendation? And, letters of recommendation, you get a professor that doesn't know you as well, they can speak on you, like they attended classes, they got a 3.0, they asked questions, that could be great. But, if you get to know them, they get to know you over time, if they're able to say, yeah, they attended class, they did great, straight A student, but they're also involved in this leadership on campus, they've done this on campus, it makes it that much stronger. And so if you don't have those yet, it's okay, but start building those. That definitely helps out. For our prep program, we don't have any, we got rid of our letter of recommendation requirement just to make the process a little bit easier for people. And so, yeah, that one doesn't need any letters of recommendation. And that brings me to next point I wanted to make sure to discuss. With our applications, people ask, what can I do to put out a good application? It really is just following the prompts, as easy as it sounds. Both prompts, they're a little bit different, but they really get to the root of, why medicine or why the health professions, and who are you? If you're able to let us know who you are, your why medicine, and what you've done to, start preparing for all that, that can really set your application apart from others. Because sometimes, people think they're scratching the surface, but we don't know the context of your life. And so sometimes, it doesn't give us too much information about you. And so my biggest advice is, if you're able to do that, and then also have other people look it over to really see if, what you're trying to, the message that you're trying to get across is actually coming through in your personal statement. Yeah, I would say that is my biggest advice. We'll help you once you're in, we'll help you get, other resources and help you get connected and really talk more about letters of recommendation and personal statements and all that. But for now, I would say just make sure you follow the prompts, get other people to read your personal statements, and we'll break down the whole process. I see a question, BCPM as in science GPA. Yes. Generally speaking, that is the science GPA. Great question. But just want to remind you, we do have all these different resources. So just go ahead and, attend our office hours, attend a guidance appointment, come to our events. Obviously, we're going to let you know about the David Geffen School of Medicine, but our office is, a pathway program. We want to make sure you get into any medical school. And so we will help you, learn about different medical schools. We'll tell you about different resources that exist that a lot of students don't know exist, to make, there's a fee assistance program that can help applying to medical school more affordable and more attainable. And so we'll break down those aspects for you. Even if you're not part of our program, we want to help you. And so feel free to reach out. But if there's any questions now I can help you with, please feel free to ask. I'm sure other people have the same question you might have if you're nervous asking.
So I just threw in the chat the link to the fee assistance program. If you've not heard about that before, as Gabriel was sharing, the AAMC, which stands for the Association of American Medical Colleges, which there are a lot of acronyms in pre-health advising. They oversee the application process for the allopathic schools, which are also known as MD schools. And so they provide funding, a certain amount of funding for that for each year for students who are applying to help cover your primary and oftentimes secondary application. So it's a really great program. And as Gabriel said, he can and his team can help break down the application and go through it And we are happy to help with that as well. There's also a separate application fee assistance program for ACOMAs, which if you've heard of osteopathic schools, it's a little bit different. UCLA is an allopathic school like UCR is, but we also have students applying to DO schools, and they use somewhat very similar to AAMC, but it's a different process. So we're happy to help go over that if you have questions about the DO process as well. Other questions? So we will have this recording on our YouTube channel, and Gabriel and Elizabeth, I'll follow up once it's posted, and everybody that's here today will follow up with an email. We have your email from logging in, registering either this morning or prior to this morning. So it usually takes us about a week. We'll have that on our YouTube channel. That's accessible by anybody. You don't have to authenticate or log in. And you can share that with friends. If you're in pre-health clubs or organizations, you can send this, pass this video along as well. And students are welcome to connect with UCLA or connect with our office for questions or how to move forward.
Yeah, and I just want to say, you all are taking the right step. I mean, just asking these questions, attending the session, you're setting yourself up for success. And yeah, you know, utilize all your resources, whether it's HPAC, us, whoever, you know, we just want to make sure you're connected to the right people to find success on your path, because you got this. And so we're just here to help you along the way. So just thank you again for hosting us, and we really appreciate it.
Absolutely. Thanks, Gabriel. Thanks, Elizabeth.
Thank you.
And thank you to our students that are here. Again, please do reach out to us if you have questions, and we look forward to working with you and supporting you in your pre-health journey.